When doctors and nurses who treat service members and their families make serious and even deadly mistakes, their identities are often kept secret. We've discovered mistakes, misconduct, and malpractice that's all hidden from view and paid for with tax dollars.
Moving them legs, he loved moving them legs.
As a baby, Zamari Reese was a force of nature in his military family.
And then 12 days after his first birthday, that's when everything turned the corner.
That's when court records say he went to Walter Reed Medical Center. Zamari was supposed to get ear tubes, a procedure hundreds of thousands of kids have each year, and have his adenoids removed, another common surgery for children. It was all supposed to be quick and simple. It wasn't.
This was him the morning of his surgery, and this is how they returned him to me.
A lawsuit filed by the family against the government says Zamari came out of surgery suffering a permanent brain injury caused by a lack of oxygen after military doctors carried on even as he struggled to breathe and his heart failed. The suit claims his parents weren't specifically warned that Zamari, who has sickle cell and reactive airway disease, was at greater risk for complications or even death.
The sad part about this case is this procedure could have been stopped at any moment, with no harm to this child.
Zamari, now 8 years old, is wheelchair-bound and requires round-the-clock care from his mother, with a judge awarding the family millions to cover the cost.
No amount of money will replace what they took from my child.
Our national investigative team analyzed the numbers from an annual report made to Congress. Since September of 2009, we found nearly 1,500 medical malpractice claims solely from the military system have cost taxpayers almost $1 billion.
That tells me there's a very significant problem with military medicine that needs to be looked at and addressed.
That annual report to Congress doesn't name names. In the civilian world, though, malpractice judgments are often included in a doctor's profile on state medical board websites anyone can access. But that's not often the case for many military providers.
Right now, the secrecy isn't really helping anyone except for people who are bad actors.
Steve Ellis, a Coast Guard veteran, runs Taxpayers for Common Sense, a government watchdog group. He says the malpractice spending raises big questions Congress should be asking about military health care quality and transparency.
And the government should be putting this information out already. It's embarrassing.
Since May 2022, we've filed 9 Freedom of Information Act requests with the Defense Department and Defense Health Agency, as well as the individual branches of service, asking for malpractice and discipline information. Our requests have been repeatedly denied.
You're doing these stories to let everyone know the truth, and the DOD is fighting you from letting you know the truth. Why are they hiding it? Why are they hiding it? Because it's bad.
After the threat of potential action from our legal team, we were finally given data never before seen by the public. It shows that between 2018 and 2022, there have been at least 478 military medical providers reported by the Department of Defense to something called the National Practitioner Data Bank. That's a confidential government repository that houses disciplinary records and malpractice judgments against healthcare professionals across the country. It includes cases involving misconduct and mistakes, even injuries and deaths. But service members and members of the public can't see who's in there.
Does that need to change? Sure it does. One more thing that the DOD should do, but they don't need a law to do that. They could do it on their own. They could just provide this information.
Our information requests ask for the names of military providers reported by the Defense Health Agency. We didn't get them, but we're continuing to fight. The agency wouldn't do an interview and did little more than cite federal code when asked why discipline involving problem military providers is kept secret from the service members they treat.
My husband put those boots on before my son's injury, and he continued to put those boots on after.
Although her husband has ended his service to his country, Tamika Harris Reese is soldiering on with the task of caring for their son. Zamari Reese, another casualty of military malpractice.
It's important to note that none of the doctors involved in the Reese case have any disciplinary action listed on their public state medical board websites. Now, if you or any member of your family has dealt with military malpractice, we want to hear from you. Go online, go to InvestigateTV.com/survey. Fill out the survey there. Tell us all about your experiences so we can continue this reporting.